Hello everyone, nice to meet you here. Today I want to share with you some basic knowledge about how to look after people who suffer from respiratory system disorders. Now, when we talk about respiratory disorders, it mainly includes some problems such as asthma or chronic obstructive airway disease. Now, chronic obstructive airway disease is mainly caused by smoking. So if you have any family members who have long-term smoking history, I really suggest you to consider these options to look after them. The first thing is promoting clear airway. Now, when patients smokes a lot, their airway is easily to get inflamed. When the airway is inflamed, it will become really swollen, secrete a lot of mucus and phlegms, and also become narrowed. So the air could not easily flow into the lung. So you see, a lot of times I believe you see smoking people always cough and um, cough up the phlegm. So they have a lot of mucus built up in their airway. So how can we help them? Is firstly, make sure they drink enough water. At least 2 to 3 liters water a day could help patients to dilute the secretions in their airway and make it easy to cough out. Um, so first thing is prevent dehydration and make sure patients drink enough fluids. Secondly, maintain a good nutritional status. If patient is obese, we need to tell them to reduce weight and measure the weight every day. Also restrict the sodium intake. Don't put too much salt in their food because sodium could make their blood pressure increase, which will make breathing worse. So control weight and restrict sodium. Also, make sure the food contain enough iron. Iron is one component of your blood which makes red blood cells. So if you don't have enough blood, you will feel short of breath because blood carries oxygen. So make sure the food is low in sodium, low in fat, high in iron, and rich in different types of vitamins. The third thing is very important is stop smoking. If patient is a smoker, they always have trouble with breathing because their phlegms build up in their airway constantly. So we have to tell patients to reduce cigarettes and cease the smoking. It is very important. Several ways to stop smoking include using nicotine patch or nicotine gum, chewing the gum which have the something that replace nicotine, so will be very helpful. Also, we can use nebulization and humidification. What is nebulizer? Nebulization means you can buy a nebulizer. It's equipment that we can dip the water, stereo water into this equipment, and then this equipment can make the water become steam, and then you inhale this steam into your airway, and the steam could dilute the secretion again in your airway and make you feel easy to cough up this phlegm. So in general, nebulization or humidification reduces the viscosity of secretions, facilitating easy expectoration. So remember, nebulizer means that this equipment can convert the water into steams, and you will apply a mask on your face and then inhale these steams. These steams could humidify your secretions which build up in your airway and make you feel easy to cough out those secretions. Another thing is that we have to make sure patients sit in the correct position. The good position for shorter breath is always upright position. So sit your patients up because when you sit up, the gravity can make your blood to flow the base of the lung, improve the ventilation of the lung. Also, when you sit up, the gravity can push your organs down to your stomach, down to your abdomen, and give the lung enough space to breathe, to expand. So sitting up can ease the breathing. Now, if patient could not sit up, you can put pillows on the patient's back, neck, or head and arms to support their head, to support them and make them sit up as much as possible. Also, elevate patient's head when they're sleeping. One more strategy which will be very helpful is chest physiotherapy. Now, you can tell your patients to do deep breathing and coughing exercise. When we do deep breathing exercise, we can fully expand the lung and give the lung more training to help the lung to expand, close, and make the lung to have more exercise so patients could help to build up a healthy breathing pattern. Now, when you tell your patient to do deep breathing exercise, tell them to breathe through the nose and maximally breathe until they cannot inhale any more air, and then hold the breath for 1 to 3 seconds, and then slowly exhale the air through the pursed lips, through the lips, until the air is fully expelled. So in this way, when you do deep breathing exercise, you actually practice your lung. You actually help your lung to expand more often to prevent the lung infection and to clear the airway as well. Thank you very much for listening. Hopefully, this little session could help you gain a little bit more knowledge.